The Department of Health recently released updated maternal care guidelines, which now include a new chapter on respectful maternity care to address the widespread issue of obstetric violence within the healthcare system. Obstetric violence is a pervasive but underreported form of gender-based violence, and 16 Days of Activism provides a timely opportunity to highlight the harmful practices that undermine women's rights and dignity during childbirth. The Embrace movement, together with their coalition partners, have written an open letter to key South African ministers calling for a coordinated government response to tackle the high levels of obstetric violence in South Africa's healthcare facilities. And joining us now is Nonkululeko Mbuli, Advocacy and Communications Strategist at Embrace, the Movement for Mothers, and Khuliso Managa, who is Sexual Reproductive Health and Rights Attorney at the Women's Legal Center. Good morning, ladies.
Morning. Thank you so much, Ms. Chava.
Thank you for your time. Before I get into this conversation, I would like to just have the viewers take a look at this.
A girl that had her uterus stolen. While I was in pain, they kept shouting at me, "Why did you come to this hospital?"
I was neglected and I was ignored, and it was extremely traumatic.
I knew that I was in pain, but that was the least of my concern at the time. I honestly believed that she was going to die.
This documentary called Push Comes to Shove is a documentary by Embrace, the Movement for Mothers. And I'll start with you, Nonkululeko. Thank you very much for your time. Firstly, let's talk about this new Respectful Maternity Care chapter. What prompted it? Let's start with the contents of the letter that you wrote for various ministers, and let's define obstetric violence.
All right, thank you, Ms. Chava. So I think let's start with a definition of what obstetric violence is. So obstetric violence refers to violence and rights violations that take place in the healthcare system or in healthcare settings, affecting women during pregnancy, during childbirth, and also in the postpartum period. And obstetric violence is a form of gender-based violence. It's a form of human rights abuses affecting girls, women, and birthing people. So the new guidelines are really, an attempt to outline the quality and the standard of care, as well as protocols and procedures during peripartum healthcare. The last guidelines were produced in 2016, and this is the latest iteration of those guidelines. And what's significant is that there is now this dedicated chapter to respectful maternity care. And what respectful maternity care is it's a rights-based approach to maternal health care that ensures that women and girls are treated with dignity, with respect, and with compassion while accessing reproductive health care. And it's really both a response to and also a preventative measure against abusive, neglectful, and harmful practices in maternal health care settings.
And what's even interesting is that the perpetrators of this form of gender-based violence are in fact the majority women, who are the nurses or doctors on duty who are responsible for caring for these mothers who are in labor. So I want to ask you, Khuliso, what is a case that has stood out for you in the work that you've done as a sexual and reproductive health and rights attorney?
Oh gosh, to pick one would be such an injustice because there have been
so many horrible stories that women have been kind of sharing about their experiences. And I think in the process of the last few years of bringing kind of light to this issue, what's been most jarring, I think, maybe not a specific case, but what's been most jarring has been how much so many women don't understand that this has been a violation of their rights and aren't familiar with the concept of obstetric violence, because this is a concept that a lot of women are told, it's kind of part of the birthing process. You're supposed to be experiencing pain. Birth is not for the weak, and so anything that happens within that kind of experience of pregnancy and birth, you should expect it. It's part of the process. And so for a lot of women, many women have come forward with their own experiences and stories, because birth and pregnancy are such a significant time in a woman's life that you always acutely remember the experience. And in addition, if you've experienced violence, abuse, sexual harassment in that space, that trauma sits with you, and it makes it very difficult then for you to trust the healthcare space and also to kind of go on with accessing healthcare or proceeding with motherhood from that point on. So I think the most jarring thing has been how unrecognized and unrealized this type of violence has been, and how much women have taken for granted or have kind of been gaslit into accepting this as part of proper procedure.
Yeah, and speaking of this form of GBV being unrecognized, really, in your letter, you say, ministers, your departments are pivotal to recognizing obstetric violence as a form of GBV in health policies and legislation. How far do you think we've come as a country in that regard?
I think we are still very much so at fundamental phases. We haven't gone very far at all. The first time in which obstetric violence has been kind of mentioned as a term was in the NSP kind of roundtables that were being had about 2 years ago, and that didn't really make it all the way through to kind of the GBV bill. So in a lot of our policies and a lot of our wording and a lot of our budgeting, the idea of obstetric violence hasn't been recognized, because we like to kind of compare it to kind of how domestic violence kind of started out in its roots, where at its initial phases, it was kind of recognized as just common assault or just common, abuse. And so why was there a necessity to create its own piece in legislation or own measures? And similar to that trajectory, this needs to go through that same process where it needs to be recognized as a form of violence of GBV. It needs to be given proper attention and sectorial responses. So it involves Department of Health, it involves Department of Education, it involves DSD and all of these functionaries and legislator to bring about a sectorial response, because at the end of the day, it's not just about kind of the fault of one healthcare worker or two healthcare workers. It's a systematic issue where they themselves are kind of caught in a web of systematic pressure, of lack of resourcing, not enough funding. The rooms are quite small, so there's not an option to give women privacy. So all of these things also kind of lend to the issue, and leave kind of healthcare workers in quite desperate or egregious positions. And they themselves, when you engage with them, it's never from kind of malicious intent, but it's always a part of this systematic environment that creates and enables obstetric violence. So that's why we encourage kind of a sectorial response to this, and why in our letter we are calling for different state organs to kind of respond to this, because that's how you really deal with something that's this embedded in kind of the crux of our healthcare system.
Nonkululeko, I'll just close off with you just to find out, has the government come to the party? And if so or if not, what are your demands?
So that's a very good question. So like Khuliso mentioned, the first time it was sort of formally recognized in a very small but significant way was at the 2022 GBV Presidential Summit. But not much has happened since then. So we do definitely see the Respectful Maternity Care chapter as a very significant kind of policy step. But there's a lot of work that needs to be done. So firstly, there's a need to recognize obstetric violence as a form of GBV be, which then, like Khuliso said, opens the door to legal protections and accountability, and importantly, justice for survivors of obstetric violence. And I think it's important to name it because then it helps us understand the systemic nature of obstetric violence and holds the system accountable. So we are calling on, the Ministry of Justice and Constitutional Development to really look into that. Secondly, resourcing respectful maternity care. So like many things in South Africa, it looks great on paper, but when it comes to implementation, we fall short. And a big part of this is because we do not have an indication of whether there are resources that have been allocated to implementing respectful maternity care. So as we know, the healthcare system is under-resourced, it's overburdened, and particularly maternity healthcare and reproductive healthcare. So addressing obstetric violence really requires us acknowledging these systemic failings, and it requires us funding things like adequate staffing, training in respectful maternity care for health workers, major infrastructure improvements. And, without these actions, these guidelines really risk, becoming an aspiration rather than something practical and implementable. Also looking at, improving health worker conditions. So it's not just about the technical skills or the hard skills. So it's also things like training in empathy and trauma-informed care, and also providing adequate mental health support for staff. Yeah.
Thank you so much. We're going to have to leave it right there. We have unfortunately run out of time.